Hello, CAM practitioners. Welcome to another informative journey into the world of homeopathy, especially tailored for your clinical practice. In today's video, we'll delve into selected quotes from Part 2 of Samuel Hahnemann's seminal work, Organon of Medicine. These timeless nuggets of wisdom will enhance your understanding and application of homeopathic principles, making your practice more effective and enriching for your patients. Stay tuned to discover invaluable insights that can revolutionize your clinical approach. The diseases of mankind consist merely of groups of certain symptoms, which cannot be destroyed but by the aid of medicines. The diseases of mankind resolve themselves into two classes. The first are rapid operations of the vital power. These are called acute diseases. The others, remove it by degrees so far from the state of health, are known by the appellation of chronic diseases. Acute diseases attack single individuals and arise from some pernicious cause to which they have been exposed. The true natural chronic diseases are those which are produced by a chronic miasm, making continual progress in the body when no specific curative remedy is opposed to them. This examination of a particular case of disease requires, on the part of the physician, an unprejudiced mind, sound understanding, attention, and fidelity in observing and tracing the image of the disease. The patient details his sufferings. The persons who are about him relate what he has complained of. The physician sees, hears, and observes with his other senses whatever there is changed or extraordinary in the patient. The second point in the duty of the physician is to examine into the instruments destined to cure natural diseases, to study the morbific powers of medicines. There is no safer or more natural method of discovering the effects of medicines on the health of man than by trying them separately and singly, in moderate doses, upon healthy individuals. Medicines, in creating a morbid state in healthy persons, follow fixed and eternal laws of nature. Of all the pure experiments relative to the changes which simple medicines produce and the morbid symptoms they excite in healthy persons, those are always the best which a physician, enjoying a good state of health, makes on his own person. The third point in the duty of a physician is to employ those medicines whose pure effects have been proved upon a healthy person in the manner best suited to the cure of natural diseases, homeopathically. The most appropriate and certain homeopathic remedy that can be employed. It is the specific remedy in this case of disease. In searching after a homeopathic specific remedy, we ought to be particularly and almost exclusively attentive to the symptoms that are striking, singular, extraordinary, and peculiar characteristic. The more homeopathic, suitable, and specific will this medicine be in the present case. A disease that is of no very long standing ordinarily yields without any great degree of suffering to a first dose of this remedy. The moral state of the patient is often that which is most decisive in the choice of the homeopathic remedy. It is necessary to oppose to them a remedy possessing a morbific power as similar as possible to the disease itself, in the effect which it produces upon the mind and body of persons in health. The best, most appropriate, and serviceable method in intermittent fevers is to administer the remedy immediately, or very shortly after the termination of the paroxysm. Epidemical intermittent fevers have the nature of chronic diseases composed of individual acute paroxysms. Both in acute and chronic diseases, every perceptible amelioration that takes place making continual progress formally forbids the repetition of any medicine whatever. We hope you found these selected quotes from Samuel Hahnemann's Organon of Medicine insightful and beneficial for your CAM practice. By integrating these timeless principles into your clinical approach, you can enhance patient outcomes and foster a deeper understanding of homeopathy. Don't forget to subscribe to our channel and turn on notifications for more expert content that supports your journey as a CAM practitioner. Until next time, keep making a difference, one patient at a time.